So CAR T-cell therapy is a novel therapy that's now FDA approved for several hematologic malignancies, including multiple myeloma, lymphoma, and acute lymphoblastic leukemia. It is also a very expensive therapy because what we find is the cost of the therapy itself can be $500,000. And on top of that, there is a lot of cost with lodging of patients close to the cancer center, hospitalization, all of that. And so far, we know the absolute cost, but we don't know what the financial burden on the patients is because oftentimes a lot of these costs are picked up by the insurance company. And the hypothesis is that, patients may not face that much of financial burden. So we designed this study to ask patients both, survey-based questions using the cost facet survey, which is a validated tool for financial toxicity, as well as conduct interviews with them and their caregivers prior to CAR T and then multiple points after CAR T cell therapy. And what we found was coming into CAR T cell therapy, patients come in with various levels of financial burden. However, across the board, it does get worse over time. So more people, experience financial toxicity 3 to 6 months after CAR T than they were experiencing at the start of CAR T cell therapy, which really tells us that patients do experience a financial burden. And when we talked to the patients and their caregivers, a few themes came up. Where was the financial pressure coming from? Travel to the cancer center, which provides CAR T, which can be further away from their home. So they really need to relocate for a month or 2 months, sometimes even, to get CAR T cell therapy. They need to have a caregiver and their caregiver needs to take time off from work. And then, of course, insurance doesn't cover everything. So sometimes their co-pays and deductibles add up and can be thousands of dollars. And so what we were finding is patients were having to downsize their primary, homes. They were having to give up on their hobbies. So it really tells us there's a long way for us to go, and we need to do a lot more for our patients to support them as they go through CAR T cell therapy.